Hello.
Hey.
Sorry, I just finished a meeting and I am 1 minute late. All right. I'm gonna wait another minute so we can start and open my agenda. All right, welcome everybody. My name is Zoila Copiano and I am the chair of this committee, subcommittee, and the Housing and Stability Director, Community Action. Um, let's introduce ourselves again. Oh, we have new people. We have Heather and Leslie. Um, yeah. And tell me what's your favorite drink now that it feels like we're starting to change the weather to cold. My favorite is pumpkin latte. So I'm gonna put corn and I'm going to pick um Kim.
Morning, afternoon. Wow. I'm Kim Ezel, she, her pronouns, strategic program manager for strategic initiatives with the city of Tigard. And my favorite drink now that it's getting colder, I am back on tea and started up my little hot water pot over to the side just last week. So definitely back on that game. And I'll pass it off to Heather.
Hey everyone, Heather Scriber, I use she, her pronouns. I'm the data and evaluation supervisor for Washington County. And say my favorite drink this time of year is actually the pumpkin spice chai latte from Insomnia Coffee. So I'm real excited next time I go into the office to get one of those. They're my favorite. And I will pass it off to Catherine.
Hi, everyone. I'm Catherine, Catherine Gallion, Program Manager, Department of Housing Services. And I think I just switched from iced coffee back to hot coffee this time of year, but nothing with pumpkin in it because gross. Not to offend any pumpkin lovers. And I'll hand it over to Marcia.
Hi, everyone. I'm Marcia Hilly, she, her pronouns. I'm the executive director at Sequoia, and I'm kind of boring. I drink coffee all year round, so I'm sticking with it. And my apologies in advance. I'm going to have to take off a little early today. And I will kick it to Sean.
Good afternoon, Sean Cardwell, Executive Director of the Forest Grove Foundation. Thanks for having me back. I'm sorry for my long absences. The drink of choice would be a chai tea latte. Kick it to, how about Leslie?
Hi, everyone. I'm Leslie Gong. I she, her pronouns. I'm the Health and Housing Integration Program Coordinator in Washington County. I will say apple cider, hot apple cider with the apple cider donuts. All things apple. Um, I'll pass it over to Nadia.
Hey all, I'm Nadia Mohammed. I am the advisory bodies coordinator over at Washington County Department of Housing and the Homeless Services Division. And I would say right now I'm feeling like a mocha, and that would be this time of year. And who hasn't gone yet? Lindsay?
Hi, everyone. Lindsay Downen, she, her, with New Narrative. I will probably also lean in on being a tea drinker this time of year and this time of day. Let's see. I will pass it over to Kiyomi?
Yes. I am Kiyomi Arbuckle, Community Services Coordinator for the City of Hillsborough. I am also not a coffee drinker, so I would say tea, but in general, I just don't like hot things, so Capri Suns year round.
And I think we have a phone number, 971.
Hi, this is Nicole Sting with Washington County. I missed the welcome question, but I'm going to assume what type of coffee do you like? And I'm a big fan of sparkling Americanos.
You're close. So what's your favorite drink during this change of the weather? So.
Well then I am a warm coffee person. I like a good latte when it's cold out.
All right. Okay, welcome. Oh, and we have Jess. Jess Larson. She's probably busy. All right, we can move to our first item on our agenda, and it's going to be the implementation and Tri-County Homeless Management Information System Vendor RFP process. Ugh, by Heather. I'm scared.
All right. Before I go into this, I'm going to apologize if you guys hear any weird banging or noises. I'm getting my roof replaced right now. It is quite noisy for me in the background, so I hope it doesn't come through. But if you hear something, it's that. Okay, so now to dive into our work. So I think we're just trying to get caught up on kind of an update for this group and then figuring out where we're going to go with some next steps on the HMIS implementation. So I'm going to provide some updates about some work that has been happening in the region and then kind of where we are for the next steps. So to start with, basically back in, I think it was about October of last year, the Multnomah County Department of County Assets, also known as the DCA, which is the department in Multnomah County that oversees the new HMIS implementation that launched this March. They, back in October of last year, kind of prior to our system implementation changeover, they actually initiated a process for a regional strategic technology analysis. The goal of that analysis was essentially to meet with various stakeholders across all 3 counties in the region to understand the needs from the region for our HMIS. They partnered with a consulting firm called Gardner Consulting, and they did a lot of interviews and stakeholder kind of engagement to try to figure out, how are we using our HMIS? What are the gaps in our HMIS? What are the pain points? What are our wish list items? Kind of just like, how is HMIS working for us in our ideal world? Like, what is it that we really want from an HMIS, and is our HMIS doing that or not? So within Washington County, the stakeholders that were included in that kind of initial stakeholder engagement process was my team, the data and evaluation team within Washington County. They also had a stakeholder interview session with the program implementation branch and members from that part of the Washington County team. And then they also joined our monthly quality assurance program meeting. So all of the QAP staff members that we had by mid-November, the Gardner consultants came and joined that to do a feedback session with that. So that's where we got a lot of feedback from those within Washington County. And Gardner kind of wrapped up that work and kind of came up with an analysis that they launched. I think it was, if my memory serves me correctly, it was around February of last year where they kind of revealed the results of this analysis. And essentially what they found is that the current vendor that we are using for our HMIS is not really fitting our needs. Through all the stakeholder analysis, they identified 50 capabilities that we need in our HMIS, and they found that only 8 of those are fully performed within the WellSky HMIS that we currently have. Some of those capabilities are not being fully performed within HMIS due to us not being able to implement it. Like, could be just that we haven't had the capacity to fully build out and utilize the tool, largely due to sometimes how challenging those things could be. Some of it is just things that we couldn't even do if we wanted in our HMIS at all. So they started with that. And then they did what they called a market analysis, where they reviewed, well, what are all the other vendors out there that can provide HMIS services? And they tried to look at all of these business capabilities that were outlined as part of the stakeholder meetings, and then evaluate the other HMIS vendors out there to see how many of them could fill those capabilities. I think if I'm remembering correctly, there's like 40 different HMIS vendors out there, and they kind of filtered that down through a lot of different processes to focus on 5 final vendors where they provided like an in-depth analysis. And for each of those 5, they gave them like a fit category of high, medium, or low across 3 different categories, and then an overall fit. So they had functional needs, which is more like the day-to-day data entry, then also the technical entry, some more of the back end, really nitty-gritty technical things that go into like how you administer the system or how you pull data out of the system. And then they also just did a needs analysis or a meeting analysis based off of the vendor or product alignment, kind of like, how does this vendor, where does their HMIS fall in their overall suite of products? How big are they? Things like that. Essentially trying to figure out, is this vendor even like kind of like that organizational level? Within that, they essentially rated WellSky as a medium fit, and they found 2 other vendors that were rated as high. So they evaluated, it was the vendors were AdSys Tech, BitFocus, which you may have heard their product Clarity, Bonterra, Ecovia, and WellSky. And this was more off of like very initial marketing materials from these vendors. It's not like in-depth demos or anything like that. It was just like, here's the information we can find about these vendors online, or maybe having reached out to them, or, you know, it's very like high level fit. And so they did that, and the final recommendation from all of this analysis was essentially that WellSky does not seem to really fit the needs of the region for what we need out of an HMIS. So their recommended next step was to launch a RFP to actually get, you know, actually see if we could move to another vendor. And that's where we are now, essentially, where they are trying to launch this RFP. And they are, for the RFP process so far, they have had a lot of stakeholder, really in-depth interviews and work sessions with joint office staff to evaluate their needs and develop requirements. They've done a lot of business process mapping, use case development, and things like that. DCA chose to start with the joint office and then give a review period to Washington County and Clackamas County, because their assumption is that the needs of the joint office will have a lot of overlap with the needs of Washington County and Clackamas County. So their thought is, if we start by evaluating the requirements within the joint office, they could then kind of draft an RFP, meet with Washington County, Clackamas County stakeholders to review that RFP, and then give us a chance to incorporate feedback of like, no, this isn't quite right, or we need these other requirements that aren't here. And so they are looking to have this portion, this review period, relatively soon. And so we're coming to this group essentially to kind of give you guys an update that this is happening. And I think, Catherine, if I'm remembering correctly from our conversation last week, our main ask out of this group is for recommendations on who could be a good fit for the HMIS subcommittee. So that way we could stand up that subcommittee and utilize that subcommittee to help us with this requirements review and RFP feedback process, essentially.
So just to clarify, not necessarily looking for a list of names right now. Is that correct, Heather? Like, of course, send it back, but kind of a heads up. that we're looking to stand up the HMIS subcommittee very quickly so that so we have a group that can review the RFP process and make a recommendation. And if I suppose just to open it up a little bit, if you don't have specific people, just some feedback on like the types of providers, the kind of the guidelines for who types of providers, balance of providers or non-providers, or those kinds of like high level. Who do you all think might be the best kind of combination or groups of folks to provide that level of feedback? Or what thoughts do you have about it at this time?
So to understand, Washington County is going to build a HMIS subcommittee with representatives of different organizations that are familiar with the system and are users of the system to recommend to the joint office to provide feedback to the joint office on our needs.
I think it's that, and then also it'll be part of the step we'll need to bring the process to the Solutions Council. And so I think the thought process was that we would use the HMIS technical subcommittee to review the RFP, provide feedback back to Multnomah County, and then also have that be the body that kind of then funnels upward to the Solutions Council, because we will need the Solutions Council approval for the RFP in general.
Okay.
Kim, I see your hand is up.
Just a couple of first thoughts on subcommittee members. I think it'd be really important to have folks who are in HMIS and represented and using it every day, as well as folks like those of us from the city who would like to have more detailed reporting out of aggregate reporting, so that we can have both of those perspectives of folks who are in it every day, as well as folks who are just looking for some of that reporting that doesn't seem to be capable in our current HMIS system.
Did you foresee, Heather, like a time if the RIF are, out, and if it's not World Sky, I guess the consequences of that to us service providers, start with the bad and then the good.
I mean, the bad is that it's going to be a lot of time and change. So basically, it'll be a new system. So I don't know how much, like in the early stages, the providers will be impacted as we're going through the initial like crossover of implementation, because there's going to be a lot of work to make sure that we map over the existing data from one system into the new system correctly, a lot of testing of functionality and design work. So it's probably, that's going to be a big burden on my team, is figuring all of that pieces out before we then go to the providers, because we'll want to do our first level of stuff. And then we'll definitely be getting providers in the loop to do a lot more detailed testing along the way. So I think that's the bad, is that it is going to be time and effort. And we just finished, moving over from the PHB owned Well Sky implementation to now the Multnomah County owned Well Sky implementation. So it is like almost restarting that whole process with a little bit more in-depth work, because now we're switching from one tool to another. So I think that's the bad. For me, I think there's a lot of good that can come from this. I don't know much about the other vendors, but the little bit of poking that I've done into BitFocus or Ecovia, and also feedback that I've gotten. There's someone on my team who used to use Clarity, Bitfocus's product in her prior work. And I think that there are a lot of benefits from switching over, especially Kim, you brought up the reporting. When I look at Bitfocus and what they're selling for their reporting stuff, it sounds like it is light years ahead of what we can do with the WellSky product. So I just see from the very surface level information that I have seen, I think that this is is likely to be a huge positive. The one big question mark I have is cost. We don't know anything about the cost of these vendors. So that could have an impact. It could be a positive, it could be negative, it could be a neutral to the providers. Although some of the things that we are looking into with these HMIS vendors is like one of the big gaps with WellSky is having case management, like really being an effective case management tool, like having a good way to have notes and things like that. And I know some of our providers have actually implemented their own case management tools, but if we get an HMIS that can do that case management, it could actually be like a cost savings for some providers. So it's a big question mark in the cost, but that could be a factor in all of this. And one thing that I will flag that I thought was really interesting to learn out of the Gardner strategic analysis is if you look at the top, I think 15 COCs across all of the United States, the Multnomah or the Tri-County region actually fits in that top 15 if you combine us all together. We're the only ones using WellSky. The other ones are all using either Bitfocus or Ecovia, and then one of the COCs has their own tool that they built themselves. So I think that kind of also tells you a little bit about what I think could be gained from this. The complexity of our system is just very atypical for what WellSky has been equipped to handle.
Lindsay.
So just want to acknowledge, I think that this is exciting and long overdue, but a huge change lift. So calling that out. And I'm curious, so would joint office essentially be project managing this work long-term post, like RFP and, and then future implementation? I'm imagining with support from Washington and Clackamas County, but just kind of thinking, and then I know this is kind of the dream question, but the curiosity that I'm guessing a lot of us have is, has anyone said anything yet about a time frame and how far out we would be looking at to an actual change and new implementation?
Okay, so for the first question about who's going to be doing the project management, it's actually the Multnomah County Department of County Assets who will do all
So they
of the
are
project.
okay, thank you.
Yeah, it's technically a different group than the joint office because their DCA, as they are abbreviated, as essentially their IT. So this gets situated into their IT. So their IT is handling all of the project management. And then we should be also engaging with with our Multnomah County managed HMIS. We are supposed to have a HMIS leadership council that we are also working on getting stood up. And that group will be heavily involved as well in this process because we need a good governance structure to make these types of decisions. So that's the project management. They're also utilizing Gardner consultants still. So they had Gardner consultants do a lot of the technology analysis. They have Gardner doing the RFP. So I don't know, I envision that Gardner will kind of continue on as we're launching this project. In terms of the time frame, Multnomah County is very, very committed to doing this as quickly as possible. And in their ideal world, we'd be launching the RFP in as early as November and getting vendor demos, in that November, December timeline. Like they are trying to move as quickly as possible. I think their goal is to potentially choose a new vendor like as early as like sometime Q1 next year. If we could move as quickly as they want us to move, I think that's where we're going to actually run into challenges of like we need to have our spaces set up and our like our chances to take it through like kind of all of our steps along the way, where we might end up slowing down that time frame a little bit to make sure that we've engaged the proper people within the county to give them the proper feedback. So that's kind of like the timeline for the RFP and choosing a vendor, but then from there, actually implementing whatever vendor gets going. I feel like that's a year, 2 years out. It's just going to be a lot of work moving things forward. And it'll probably depend on the vendor and their capabilities and how effective they are at moving things forward. But I do see that as a decently long process.
I'll just add, maybe for some context here for everyone, it is one of the kind of responsibilities of a COC to be involved in the selection of the HMIS vendor. And so essentially all 3 COCs would need to kind of approve the switch in order for it to go through. And so that's, I think, a big part, and correct me if I'm wrong, Heather, a big part of why we're hoping to engage our COC, which is, you know, not just the Solutions Council, but the actual members and providers and partners within our COC in the process early and often, as early and often as possible, given the kind of compressed timeline from Multnomah County.
Hi, Heather, this is Marcia. And you might not be able to answer this, but my knowledge of HMIS is basically what I hear from my staff, that it's not very user-friendly, doesn't allow for some of the information that they'd like to have being present in the system. What are some of the broader concerns? I'm just curious from those who have a much broader perspective than I do.
I will say some of the concepts that came back from the strategic technology analysis, user friendliness was a very, very, very common theme. User friendliness, it was a huge concern. Also just more about like care coordination, so case conferencing and creating by name lists in the system was a huge one. Case management, like coordination from that perspective, so like case management notes and being able to share all that information across providers. I am trying to look at some of the notes from this, more stuff about just kind of overall capacity management as well. So, you know, we use Shelter's module, but it's not the most, it's not the best tool for managing capacity and your caseload and your workloads as well, but it's not the best in a vacuum. It's the best that we can do in WellSky. So I think those are kind of some of the big pain points. And then data and reporting is another significant pain point. It's just not as, it's a very challenging system to pull data from and to get it timely and accurately. Yeah, those are some of the big ones.
Yes, thank you. I kind of what I guessed, but.
Mm-hmm.
Heather, would it be possible to share the original report back out to this group, since it's been a minute, so that folks can see that the original findings?
Yeah, I need to dig through my records and figure out where the final copy is. Like right now I'm referencing a draft version. So I want to make sure I share out the final copy.
Heather, if you can send that out to me, then I'll send it out to the group. And I just want to keep in mind the time, because it's 3:30. If we want to, if anyone has like any thoughts or suggestions or recommendations, they can email me, and I can make sure to pass that along.
Thank you, Nadia. Thank you, Heather. Thank you. I saw Sean, your hand was up, but you put it down.
I was watching. I can dig into my question on my own time and see if I can find the answer.
And now next we have the Q4 report from Catherine.
Hi, hopefully I can be quick running through this and save as much time as possible for questions and make up some time. I'm gonna share my screen and I'm gonna do it the cheaty way because I still all these years into remote meetings struggle to do the presenter view with only 2 screens. I need 3 to do presenter view. So this is just a subset of our Q4 report. If the entire report was presented to the Board of County Commissioners and was recorded. So Jess, who's here with us today, Molly, our Executive Director, and Jill, our Assistant Director of on the Housing Authority side, presented to the Board of County Commissioners. And so we're just bringing the programmatic highlights to you all today. And starting here with our outcomes related to shelter bed development, we had a goal of adding 60 beds to our system. We were able to add 90 during last fiscal year. And this does not also include what had previously been winter shelter beds to year round. That's not reflected here, but that was another expansion of our sheltering capacity that came through this year. For eviction prevention, our goal was 500, and we actually were able to support 1,568 households with eviction prevention resources. So huge kudos to Community Action and Central Cultural for those programs. I'll just keep moving, but feel free to stop me at any moment if you have questions. Our point in time count. So as you know, we didn't do the street count this year in 2024. We did it in January 2023, and we will do it again this year in January 2025. So we'll have a new data set to compare. But we did recognize a significant decrease in unsheltered homelessness from 2020 to 2023, in 2021 even more of a decrease. So just a reflection of our the impact of those shelter bed capacity increases on our unsheltered count. Where we fell a little bit short was in our housing placement goals. So we met about 85% of our housing placement targets. We were 64 placements short in our supportive housing goal, and what is that, 47 short in our rapid rehousing goal. And we've spent a significant amount of time talking about the system barriers that we were facing throughout the year and made a significant number of changes to program operations over the course of FY 23-24 that we are anticipating will help us to carry us into next year, help us reach our goals in 24-25. And then looking ahead, so we have, we have to increase those housing placements. We set goals that we I believe are achievable, and while they may be stretch goals, they are not intended to be impossible. And so we are looking at some adjustments potentially to our referral processes and coordinated entry. Our housing application processing timelines, those are some of the course corrections that we've already made. And then just increasing the contract clarity and management to focus on prioritizing placements, which those of you who operate these programs have probably already experienced. And some additional things that are coming. We have 3 permanent shelter sites that are currently under construction. We've awarded 2 of 4 capital contracts for access centers. And then there's currently a transitional housing opportunity open to bring that program type into our continuum. So those are the things that are coming in the next year that are intended to, one, increase the stability of our system, and to improve our efficiency and ability to connect, particularly with unsheltered folks through the access centers. So I'll stop there and see if folks have any questions. Okay, I'll just add one more bit. As you all know, we've been tracking the housing placements monthly in our monthly MAC reports, and so you all are getting that information no less than monthly about how we're tracking towards our goal. So we'll continue to bring that back here and look for your input into what other adjustments can be made. That's it for me.
Thank you, Catherine. And now we have Leslie, Housing 360 pilot.
Great. I'm glad that Nadia is sharing the presentation because I am not tech savvy when it comes to coordinating presentation and presentation mode. And I am only working on a laptop. It makes it even more challenging. Okay. So again, I'm Leslie Gong. I'm the Health and Housing Integration Program Coordinator. I'm presenting on the Project 360 on behalf of Ali Alexander Sheridan. And so I'll share a bit about the proposal and likely lean on Catherine for more details if there are more questions. We can go to the next slide. Okay, so the intent of presenting today is to get your feedback. So the question is, does this program design meet the identified need for improved coordination between behavioral health services and housing for individuals experiencing homelessness? So just a question to think about when I go through the presentation. Next slide. So OHCS has allocated funds for our statewide rehousing program, the Oregon Rehousing Initiative. There's been an identified need resources to support individuals who are experiencing homelessness and have a behavioral health need. About 3.4 million of those funds have been set aside for this Housing 360 behavioral health pilot. Again, the objective is to improve the housing and behavioral health outcomes and reduce racial disparities. Next slide. So in this proposal, starting January 2025, thought is that the county will contract with community-based behavioral health providers to fund up to 3 credentialed housing service coordinators. And that may mean a qualified mental health associate or higher. And then by May, this would be implemented, ensuring that there's housing navigation and coordination services for those who are eligible. These coordinators would support bi-directional connections. And what that means is conducting outreach and engagement and referral for shelter plus care enrollment, facilitating the Community Connect assessment and housing program enrollment for participants in behavioral health programs that meet the eligibility and housing program prioritization, and then also provide behavioral health navigation services, so more of a consulting role for participants in housing programs and have an identified behavioral health need. I want to speak anything. Okay, so also that kind of relates to them participating in any healthcare case conferencing as another activity in their role. Go to the next slide. So as part of the equity improvement plan in this proposal, engaging with the Live Experience Advisory Committee and the Behavioral Health Resource Network to increase the representation in the decision-making for communities of color and people who with lived experience of homelessness and behavioral health needs. I believe that the proposal is to meet biannually with these groups as part of the overall plan. We can go to the next slide. So some of the partners, in addition to the ones that I've mentioned, Behavioral Health Division to help with, so a lot of the partners is really looking at the system gaps and helping inform the overall implementation and planning for this proposal. And so one of the partners is Behavioral Health Division to really look at the implementation planning and monitoring. Behavioral health providers like LifeWorks, New Narrative, and Sequoia, who will be participating in the overall operations, the service provision. So it will really lean on these groups to look at the scope of work, the workflows, and coordinate care organizations like HealthShare, Care Oregon, and Trillium to look at other planning opportunities. And that may include like leveraging Medicaid. Trying to see if I had other thoughts on and so these groups would be meeting quarterly, at least to talk through the plans for the implementation. Can go to the next slide. Okay. So just kind of considering the strategies that come with it. So household assistance and behavioral health services. I think housing navigation and service coordination is the core to it. And really improving that access to shelter plus care and increasing housing placements. Evidence-based services, that includes medically assisted treatment, intensive case management, assertive community treatment services, and peer supports. And then cross-collaboration, leveraging existing initiatives like the healthcare case conferencing that I mentioned, the Medicaid 1115 waiver. There's another concept that's also brewing, which is the regional healthcare and homeless integration communities, which is in collaboration with HealthShare. It's a concept to do a more care coordination and peer delivered services and data sharing on that regional level. Let's see here. Just a little bit about some of the work coordinators would do, which is receiving referrals from coordinated entry, helping with shelter plus care applications, assist in housing search and placement, support moving costs, and coordinate long-term case management services. I mentioned the navigation in behavioral health services to ensure like that warm handoff and any intervention assistance in the event of housing destabilization for shelter plus care participants. I think we can move to the next slide. Okay, so this is just a breakdown of the budget. So it's about 848,000, about 630,000 for the staffing of the housing service coordinators. Financial assistance is about 110, and administration 110 as well. Listed below are some of the goals to June 2026. I mentioned the engagement with the Lived Experience Advisory Council and the Burn Network. Some of the other goals: 45 new households are housed, 30 additional households with behavioral health navigation, and 15% in service engagement in behavioral health services, and housing retention is maintained at 90% or more throughout the pilot. Go to the next slide. So this is more of a discussion and open for feedback. What questions do you have about the design? Does the program proposed meet the identified need? And is there anything that we missed in key elements for this design? And Catherine, anything else to add or highlight?
Not from me, just happy to hear what questions folks have.
I was going to raise my hand, but I unmute. uh, I don't see here at least an identified need that we see in our own caseload of participants, those who have been house and after house, after are in permanent housing, we realize that our case management cannot meet the needs of those participants, and they may be more supported with a behavioral health case management. And yeah, if so, those who are on house and those who are house that does not, that some, our approach doesn't meet really the needs of the acuity of needs that they have. If that is also going to be included, like a pathway to that.
It is intended to be bidirectional referrals, so in a like a consultation model, right? So the staff, the QMHA or higher staff would be able to help case managers support the person in navigating the behavioral health system to get to where they need to go. That's kind of the intent.
Nice. Thank you.
I think it was Kim and then Marsha.
This is really exciting. So thank you for bringing it forward and for all the work that you've clearly put into this. It's awesome. I just had a couple questions about the goals and the budget. Is the budget the annual budget, and would you anticipate that being ongoing, or is that just for the pilot and you'd anticipate it growing over time?
I think I can take that. It's an annual budget. And the costs would be likely to grow. However, it's being funded as a pilot by OHCS. And so it would be entirely dependent on the state legislature renewing the funds.
And then my second question is the 30 additional households with behavioral health navigation. Are those households who have already been housed and are receiving the assistance? To Zoe's question, are those folks who are in the pipeline to get into housing? And where in the process are those 30 additional households?
I mean, essentially, they could be in any of the states. They could be already housed, but have an identified behavioral health need, or they could be in the process and need behavioral health supports in order to successfully become housed. I mean, it's all in a housing first model, right? So it's whatever comes first.
Awesome. Thank you, Catherine.
Marsha.
Yeah, I couple questions or comments. I think it will be a huge assist for the work that we do and connecting people with housing and with the services that they need. And then just out of curiosity, I missed something you said, Leslie, about a regional collaborative in place. Can you repeat that, please?
Yeah, so so there's like based off of the healthcare case conferencing, there's this idea of like taking healthcare case conferencing and that coordination more on a regional level. And so just thinking through like really leveraging the access to information and coordination that HealthShare could provide. Yeah, considering their role in healthcare case conferencing and as a regional agency.
Yeah, great, thanks.
Thank you, Leslie. I don't see any other question. And then last one, we have the NAFO update.
It's back to me. So just a quick update, our NOFO, the local competition for the annual COC NOFO as closed. We received 3 applications for new projects, 2 PSH, 1 rapid rehousing. And so the Equitable Procurement Subcommittee that was stood up not very long ago, I think 2 months ago, maybe, Nadia, if help me if I'm forgetting, we'll be meeting very soon. Was that right? Did I get that right?
Sounds right.
In that ballpark. And then they'll be meeting again to review the applications and score them based on the scoring criteria that this group put together, I think in maybe February. So that process is moving forward. It's fantastic to have 3 different applications. Our allocation amount was greater than anticipated, so we may be able to fund more than 1, which would be very cool. And time will tell.
All right, thank you. And Nadia just posted supported housing service plans and reports, Washington County on the chat.
The Q4 report, so like the whole report, Catherine shared a part of it.
Oh,
And
okay.
it's there under 23, 24, Q4.
All right. Click on it before we close the call.
I'll email it too.
All right. And next step, I guess, next meeting we will have.
Zoe, Sean's hand is up. Sorry.
Oh, I'm sorry, Sean. I didn't see your hand again.
No, I'm sorry. I just realized I was typing it to Leslie, but in terms of the, can I go back for a second just for the Housing 360? What's next steps, Leslie, with that? What are you guys doing next, or when do we hear next about something like that? On 2 fronts, maybe organizationally, but then in terms of this committee.
So we will put together the proposal. It's the due date is next Monday. And then I guess Catherine will just wait to hear back. I don't know, like next steps after that.
Yeah, so it'll either get funded or not funded. If it gets funded, then we'll move into implementation mode, and we'll just keep you all posted as that process goes through all the stages.
Thank you.
Great. Thank you. Yeah, I was going to talk about the next steps, and assuming this is what we will have next meeting. Coordinated entry data that we have requested to see from Community Connect coordinator, right? Okay.
Yeah, so we would like to focus on coordinated entry. Catherine can kind of maybe fill in a little bit more of those blanks, but I think there was also tied to Solutions Council, there have been some discussion about data requests that we'd like to see related to coordinated entry. And so I put that there also in case there are folks here that that have specific requests that we want to keep in mind as we're having these discussions.
Yep.
And I think the intent is to bring the data that was requested by the Solutions Council to this group as well, for your review, but also in your role as the Performance Evaluation Subcommittee to provide any further insight or other questions that you'd like to dig into.
Great.
And you can email me if it's something that like you need to mull over. Because I know we were just throwing that out there.
Well, 3:55. Thank you, everybody. And let's take 5 minutes break before our 4 p.m. meetings that some of us have. Have a great day. Bye.
Bye.